Well, welcome everyone to Vaccines and Variants, a webinar that is part of a larger project called Love Your Neighbor and Get Vaccinated, sponsored by the Markkula Center for Applied Ethics at Santa Clara University and Catholic Charities of Santa Clara County. I'm David DeCosse, the Director of Religious and Catholic Ethics at the Markkula Center at Santa Clara, and I'm really so pleased and grateful today to be joined by two very knowledgeable experts about vaccines and variants. Today we have Dr. Ranjani Chandramouli, a pediatrician and the medical director at Gardner Health Services, a healthcare network working with marginalized communities throughout Northern California. Dr. Chandramouli, thank you so much for being with us today.
Thank you.
And we also have Dr. Charles Binkley, my colleague at the Ethics Center. And Dr. Binkley is a cancer surgeon and a bioethicist and the director of bioethics at the Markkula Center at Santa Clara University. So thank you so much, Charles, for being with us today as well.
My pleasure, David. Thank you for the invitation.
So first, we're going to start with just briefly some screen share to kind of set a little context in the most general terms of where we're at in terms of the question of vaccination and the COVID-19 pandemic. So thank you, Amana. And here's our title slide. And so very basic slides here, looking at the United States as a whole. As you can see, 57, almost 58% of the population has at least one dose. Almost 50% of the population is fully vaccinated. All right, the next slide, please, Amana. Drilling down a little to California, and we see the same two data points. In California, the numbers are a little higher. We have 64.3% with at least one dose of the vaccine and 52.5% of the California population that is fully vaccinated. Great, thank you so much, Amana. All right, so Dr. Chandramouli and Dr. Binkley, those are the bigger vaccination numbers, but of course the word that is on everyone's mind right now is variant and all. So I wonder if I could start with Dr. Binkley and ask, what is a variant, and like, how does a virus produce a variant, and is this Delta variant? Why is this causing so much concern?
Thank you for that, David. So a variant is whenever an infectious entity, or really any entity at all, evolves beyond that which it started out as. And so we always take the sort of index, if you will, the index pathogen, and call that the wild type. And then as the pathogen replicates, as it gets spread from person to person, there's always the chance that a mutation will develop in its sort of DNA, RNA, depending on what sort of virus it is. And so some of those variations from the wild type will create a loss of function and will make the virus less powerful. And some of them will make the virus sort of the same. And some of them will transmit or will confer a gain of function to the virus. And that's really what a variant is. And that's what the variants that have a gain of function. And so what are the gains of function that a virus can have? And it's really twofold. Viruses can be more transmissible, meaning that more people will be infected, but they won't cause people to be any sicker, or they can be more virulent. So that same virus can have a gain of function that makes people get sicker as a result of getting it. And that's largely because it's able to evade the immune system in some way. Right now, the Delta variant seems only to be more transmissible rather than more virulent. But the concern is having a virus that would be at the same time more virulent and more transmissible, and the damage that could potentially do.
Thank you so much, Dr. Binkley. And Dr. Chandramouli, was going to swing over to you. And we've seen increasing numbers of infections around the state of California, around the country, especially in areas that are unvaccinated with lower rates of vaccination. You work with many marginalized communities around Northern California. What are you seeing in terms of how the Delta variant is affecting the communities in which you are working?
Okay, thank you, David, for having me on this webinar. It's my pleasure. And yes, as Charles was talking about, the variant can work in multiple ways. This Delta variant obviously is working in a negative way for us. It is actually now 50% almost more contagious and more transmissible than the original COVID virus that we had last year. And it definitely is affecting more of the unvaccinated people. It is proven now, we're seeing the Delta variant spikes in certain states like Arkansas, Missouri, Florida, Louisiana, and that there is definitely a direct correlation between the Delta variant and the vaccination rates. So here in Gardner, I've been with Gardner for about 32 years.
Wow.
And yeah, I've been the medical director for 6 years now. And we see about 40,000 patients, and 25% of them are uninsured, 70% of them are Medi-Cal patients. And we are seeing some patients that are coming in. And so far, what we have noticed and we have observed are that the ones that have tested positive are the unvaccinated people. That has been clear. But in terms of whether they have the Delta variant or not, that is yet to be determined, only because when we send our specimens out to Quest, the Quest lab does do the testing for all the variants, but they don't do the genetic sequence. And that's the only way you can determine whether somebody has the Delta variant or not. And I know that all lab reports, all positives are reported to the state. And the state does a random testing on all patients for the Delta variants. And that's how we know that there is that Delta variant going around. But we do know that majority of the patients that have tested positive at our clinic sites have been the unvaccinated people. We have had, I will say, we have had some breakthrough positive cases with vaccinated people, but that's far and few. We have just maybe seen about 3 of them so far that have been vaccinated in this group. And the other thing that I would like to also point out is the vaccines that are there are pretty effective. The only data that we have so far is on the Pfizer vaccine. The Pfizer vaccine has a 30% efficacy after the first dose, specifically for the Delta variant, and has an 88% after the second dose, specifically for the Delta variant. So that's a good data to have, and I'm sure Moderna and Johnson will follow through with some data for their efficacy rate as well. And Charles, please join in and see if you have any additional information on that. That'll be great. So basically, we do see a significant number of our what you call marginalized community workers, and pretty much most of them are vaccinated. I will say with Santa Clara County, as you can see, we have almost a 78% fully vaccinated rate right now. And that is a very good sign, because the only way we can control the Delta variant is to have more people vaccinated, because the Delta variant is very clearly much higher amongst the unvaccinated people.
Dr. Chandramouli, I wanted to follow up on that. President Biden and others have used the phrase, in light of the spread of the Delta variant, that at this point we're dealing with a pandemic of the unvaccinated. And you've referred, as has Dr. Binkley, to the correlation of infection with a lack of vaccination. What right now in the communities you're working with, I'm guessing migrant worker communities, other communities like that, what are the remaining obstacles to vaccination? Is it access issues? Is it hesitancy because of ideological concerns? What are you seeing in the communities you work with?
My thing is, I don't believe it's access issues, because there's plenty of places available for you to get vaccinated. I don't think that that's an access issue. We have had pop-up sites at the migrant farm workers. We've had sites over the weekends and evenings. So that has not, in my observation, that has been a big issue. I think it's more of the vaccine hesitancy. I think people are still not buying that there is some validity to the vaccine. I think they're still thinking that this is just a hoax. COVID is not real. And of course, there's a lot of people there's a small percentage of people that have abstained from getting the vaccine or deferred getting the vaccine for medical reasons. But that, I think, is very few. And of course, there is a certain element of the religious beliefs that are out there. And the other reason is because there's a lot of myths about the vaccine itself. And I think people the media has not helped with, creating some of these myths, and it's created some anxiety amongst the younger people, especially, for example, with the fertility issues that came out with the Johnson & Johnson. And so people were afraid of getting the vaccine because of that, even though every organization, ACOG and AAP and the ACIP, everybody made a stand on it and said that there was no issues, no evidence-based data for that, but it built in that fear amongst the people.
Well, thank you very much. That's really striking to hear that, and the power of those myths at this point still in the
Yes.
pandemic. Dr. Binkley, I was wondering if I could go back to you and this notion of the pandemic of the unvaccinated. And could you explain to us a little more, like, why does a variant develop among unvaccinated populations? Like, what's the correlation between lack of vaccination and then the kind of gestation, the development of a variant?
Thank you, David. So one of the difficulties is that every time the virus is transmitted from one person to another, there's the increased risk that a variant or mutation will develop, because viruses rely on the host to replicate, and then also on the host to spread. So one of the concerns about commingling people who are vaccinated with people who are unvaccinated is that if an unvaccinated person who has an infection and is shedding a large amount of viral particles transmits the virus to somebody who's already been infected or already been vaccinated, and that person actually gets the virus, if you will, or is contagious, the virus that the vaccinated person is going to shed is going to be viral particles that have evaded the immune system in some way. And so the idea is then the viral particles that an immunized person would then potentially transmit to somebody else are going to be somewhat stronger, if you will, or more potent, better at evading the immune system. And so if this continues happening, if there's this exchange back and forth, so unvaccinated to vaccinated, vaccinated to unvaccinated, unvaccinated to vaccinated, then at some point we're going to select for strains of the virus variants that are really able to evade the immune system, and then that would confer virulence. So that's one of the big concerns. There's a lot of attention right now to England specifically because of commingling of vaccinated and unvaccinated people without risk mitigation strategies. It's also why we're seeing here in the United States many places saying that they want to start masking again or implementing social distancing. It's also why people who are vaccinated, there are two things here. That's why people who are vaccinated, even if you are only associating with other vaccinated people, if those vaccinated people have had close associations with unvaccinated people, then there's an increased risk that they can become infected, because an unvaccinated person is going to be shedding more viral particles than a vaccinated person, right? So even if you're within your cohort of other vaccinated people, if those people have been in large crowds of unvaccinated and unmasked people, they're going to have a higher risk of developing the virus. And then the other thing is that the original studies that were done on the wild type virus, and Dr. Chandramouli referred to some evidence from the Pfizer vaccine specifically and its efficacy against the Delta variant. But the original studies we have were all done on a wild type variant. And so it seems like these vaccines are still effective, but maybe not as effective as they were on the wild type. And the concern is with each iteration, each variant, we may get a loss of efficacy. So does that make sense of how the commingling of those various factors takes place?
Yes, it does. It's very striking. It sort of underscores the kind of interdependence of all of us in a biological, epidemiological sense here, like it or not. May I pose here quickly a basic question someone has asked, a basic but very important one, for maybe a brief response from maybe Dr. Chandramouli. You can field this one. One of our listeners has asked, how many days do you consider someone fully vaccinated? After how many days after they've taken either the Johnson & Johnson or the first or second Pfizer or Moderna dose?
Okay.
What's the delay time there, please?
Everybody is considered fully vaccinated after 2 weeks after they receive the second of either Pfizer or Moderna or the first of the Johnson.
Either one. So after the first of Pfizer or the first of Moderna, you really need the second to get.
You do need to be fully vaccinated. 2 weeks after the second dose of Pfizer and Moderna, you're considered fully vaccinated, and 2 weeks after any Johnson, you're considered fully vaccinated.
Great, thank you. So let me follow up here too. Dr. Chandramouli, you are a pediatrician in addition to being medical director at Gardner Health. And there's a lot of concern as people are getting kids back to school. I mean, everyone is concerned about this.
Right.
So I saw the other day that the San Jose Unified School District has just announced a vaccine, what they're calling a vaccine, I'll put it in quotes, air quotes, mandate. All staff and faculty need to be vaccinated, or various provisions if they're not. As a pediatrician, as someone who has worked on the pandemic for the last year in the trenches here, do you think something like mandates in a medical sense can be helpful in terms of kids going back to school? What's your take on that?
Yeah, my take on that is I certainly do believe in mandating the vaccine, because that's the only way you can prevent this pandemic from expanding any further. I think we have reached a point where everybody needs to get back to a normal life. Everybody needs to the country needs to get back on the economy. And this is a public health hazard. This has nothing to do with your personal beliefs or any of that stuff. It is a public health hazard. And for you to control a public health hazard, the only way to mitigate that is to mandate the vaccine. Anybody that is eligible to get the vaccine should get the vaccine.
May I just follow up on that too? So asking you as a physician expert in public health, why would a mandate help stem the spread of a virus?
Basically, when you vaccinate someone, you automatically develop that immune system in that person. And the transmission rate is significantly lower in a vaccinated person compared to an unvaccinated person. So that automatically stems the transmission of the disease, and you're automatically controlling the spread of the virus.
Great, thank you so much.
That's what we've done for all childhood vaccines. Childhood vaccines, if you look back years ago, the reason why that was mandated, and then the schools mandated it, it wasn't initially, but later on the schools realized that that's the only way that they can control the spread and prevent children from getting all those serious conditions. So they mandated all the childhood vaccines. And it's the same thing. It's more of a public health hazard. It's more of controlling the really people who are immunocompromised, people who can get seriously ill from this disease, not to be infected by this.
Great, thank you so much. And Dr. Binkley, if I could go to you on the same theme of vaccine mandates. And I know that term mandate is being used. I've heard it used in reference to San Jose Unified School District, the University of California system, the California State University system, the largest university system in the entire world, I believe, Santa Clara University. They have all issued, I'm going to use the term mandate, that all staff and faculty must be vaccinated before coming to campus. Dr. Binkley, could you speak about, is that the right word to use? And what are some ethical considerations that we ought to keep in mind about something like, in air quotes again, a vaccine mandate?
So I think that's a great question, David. And the federal government, the Biden administration in particular, have gone to great pains to clarify that what they're requiring of federal employees is not a mandate. It's a requirement, but not a mandate. So I guess in the strictest sense of the word, if you mandate something and somebody chooses not to do it, they're terminated. That's the end of their employment. So instead, what federal employees at least will have the option of is they choose not to get mandated. If they choose not to be vaccinated, there is an alternative path, and that would be to get tested on a regular basis. A number of large health systems, and you can understand why there would be an additional ethical obligation for somebody who's providing healthcare, nurses, physicians, physical therapists, respiratory therapists, even people who are working in environmental services in hospitals and healthcare systems, why they would have an additional ethical obligation because they're dealing with particularly vulnerable patients who may have significant comorbidities. But health systems are requiring their employees, mandating their employees to get vaccinated and saying, if you don't get vaccinated, you're going to be terminated. And there may be a middle of the road there so that you say to your employees, we're going to require that you get mandated, or that you get vaccinated. We're going to have a path for you if you have a philosophical or religious objection to have an exemption. We'll grant those on a one-by-one basis. Our process for granting those will be transparent, it will be equitable, and there will be some way to appeal the decision for a second hearing. And then we will have, basically, if you just simply don't want to do it and you don't have some sort of legitimate request for an exemption, then you'll be terminated. So there are different ways of doing it. And that the idea of allowing people to request an exemption and really entertaining those individually, I think that's probably the right ethical balance. But the important thing about considering an exemption is that there be a policy in place for how those exemptions are going to be addressed, and that the process be applied again equitably, transparently, and that there be some way of appealing the decision, but then that appeal be the final decision. And that's going to really depend on the institution for what their tolerance, their view of exemptions is. And so there are other ways that people can seek exemptions for other things. But again, it's about the process from an ethical perspective.
Thank you so much, Dr. Binkley. And actually, Dr. Chandramouli, I wanted to go back to you on this question of exemption. And this is not so much a philosophical or religious objection, but we also hear the terminology of medical exemptions. So, and I know a lot of people who may have conditions and they're really worried. I don't want to get the vaccine because I have all these medical conditions. So could you tell us a little bit about how would that kind of exemption work for someone who's really worried about underlying medical conditions?
Yeah, I think that's a very, very interesting question. And I think that's a very debatable question also, because actually, when you really look at it, there is no medical contraindication to getting the vaccine. other than the fact that if you have a serious allergic component reaction to any of the components, or you've had a serious allergic reaction to the first time you got the vaccine, there really is no medical exemptions to getting the vaccine. However, there are patients that probably want to defer getting the vaccine due to some underlying medical conditions, like it's not a medical condition, it's like people want to defer it if they're pregnant, or if they're breastfeeding, they want to defer it to a later time, or if they have some immunocompromised conditions or getting chemotherapy or radiation, they want to defer it later on. But there really isn't a true medical exemption for getting the vaccine. And I think I think it's more related to fear of getting the vaccine than a real medical reason for not getting the vaccine. I think it's the fear that is there in the people for not, and I think it's the same thing with the, Charles was talking about all the mandate and all that stuff. I do know now that the VA has mandated all their employees to get the vaccination. And now there's a big stand for corporate America to mandate the vaccine. At Gardner, however, we are looking at the options. Like Charles said, we are requiring proof of the vaccinations, and we are going to mandate the testing of the employees every week if they have not provided proof of the vaccination. But we are not mandating the vaccine. And I think there's a lot of, it's not just ethical things that are that people are looking into, they're also looking into legalities of this. We don't have a clear understanding about the legalities. Everybody say legally, yes, you can mandate it, but we don't know what happens down the line if somebody comes back to sue you or there's a class action suit. We don't know what that entails. There is no protection. And I think that's something that all organizations need to factor in, because if there is no protection from the legal system on mandating it, people will probably choose the option of requiring the vaccination. And if they choose not to, they will mandate the testing. I think that's probably the more balanced option that most people are going to take because of the legalities of it.
And to speak to the immunocompromised patients, one of the concerns there is that it simply wouldn't work. That if somebody's immune system is impaired, either because they're getting systemic chemotherapy or that they have an autoimmune disease and they're on immunosuppressive and immunomodulating drugs, is that you get the vaccine, but the mechanisms that we rely on to protect one may be weakened, may be ineffective. And so they're not going to know if they're actually immune or not. And so it's that limbo. The other thing is that I'm really hearing a number of people who are not getting vaccinated because they're in denial. They simply think this can't happen to me, right? Right. I'm not one of them. I'm not at risk. I don't have any of these comorbid. I don't have COPD. I don't have diabetes. I'm not one of them. I drive my own car. I work from home. But I really do think that that's a fallacy. We're all one of them, and we're all vulnerable. And even if we don't think we are, it's an act of solidarity and really an act of love for our neighbor.
Well, thank you very much, Dr. Binkley and Dr. Chandramouli. Our time is regrettably up, but I was going to ask you both to sort of give a closing peroration about, vaccination and your thoughts, and you did it just on your own in both two really brilliant and moving ways. So thank you both so much for taking the time to be with us today, and thank you to all our viewers and listeners. This is, as I said, part of a series of webinars that the Ethics Center and Catholic Charities of Santa Clara County are putting on the vaccines and really how they play out and how they are playing out in marginalized communities. So please tune in. We have a series on back to school issues and vaccination that begins next Tuesday at 11 with Father John Pedigo of Catholic Charities of Santa Clara County. And we'll be talking to Father Pedigo about back to school issues in marginalized communities in light of COVID and vaccination. So this is David DeCosse from the Markkula Center of Applied Ethics at Santa Clara University. And it's been my pleasure to host this webinar of our program called Love Your Neighbor and Get Vaccinated. Thank you.
Great. Thank you so much.
Thank you.